Today we're having our first Coordinated School Health Summit. So we pull together state, local people together to see where we are with coordinated school health and how we can move forward.
What is coordinated school health?
It's looking at all the things that affect a child's health so that they can be ready to learn. So it's CDC has 8 models, the state of Louisiana components. The state of Louisiana has 10. And so it's everything from physical education, health, nursing services, mental health services, nutrition, what are we feeding our children, early childhood, all the components, that anything that influences, like the safe environment, is it tobacco-free, do they have treatment for asthma available, things like that.
Tell us about the status of health of Louisiana's children.
We do have a large obesity problem. I don't think that's a secret, as our adults also do. So we have a long way to go as far as addressing that. We're finding more and more children with diabetes, high blood pressure, very young ages of chronic diseases that we want to do something about. So I think the awareness is there, but making the steps forward, we have a long ways to go.
And what is the summit here today and tomorrow? What is that going to do in order to improve this? What are the things that the teachers are learning?
They're going to learn what resources are available in the state, so that a lot of school districts do not have funding to fund a position that it might take to coordinate this. So we're going to give them as many resources as possible to make it work with wherever they are. Maybe they have a school district with 30 schools, maybe they have a school district with 6 schools. So each district needs to come up with their own plan on how to address what they're lacking.
Are you encouraged by what you've heard here so far today?
I am. We had a speaker from Tennessee who spoke about what they're doing there, and they do have funding for the state there at state level. And what I'm encouraged to hear is that we may not have funding, but we have a lot of components and a lot of good moving parts that we just need to coordinate better.
What is your best advice for parents as this new school year comes about to make sure that their students are healthy and stay healthy?
I would say get involved and get information. Information is very powerful. So if they could find out what is going on at their school, what's going on in the school district, it's easier to support what's going on when you have the school doing the same thing that the parents are doing, the same thing that the community is doing. So I think we need to just learn more about what's going on in our community and learn more about the health of our child. What's the health status? Some people don't even know that there is issues.
I'm trying to get across the importance of school systems across the state and nation to have a local wellness policy which will affect the health and nutrition of the children across the nation.
What is a health and wellness policy? What's a good one?
Well, there are several prototypes available on the USDA website as well as on the state, Louisiana State website. But these policies will include everything from nutrition in the classroom, education. It will include nutrition in the cafeteria. It will also include physical activity and promotion of the program so that other people will know what we're doing, and then evaluating what you've done to see that if it's working or not.
What is going on in Louisiana's classrooms this coming year that maybe wasn't going on in the classrooms 10 years ago as it pertains to health and wellness?
Well, we are really encouraging, as a member of the school lunch team, we are really encouraging the access to school nutrition programs, the school lunch program, the school breakfast program, summer feeding program. 10 years ago, we didn't promote it nearly like we're doing now, and one of the reasons is because of the new meal pattern, which is much healthier for the children, and we are now seeing things such as breakfast in the classroom, where the children don't even go to the cafeteria in the morning. As soon as they get off the bus, they go straight to their classroom and go straight to activities that are related to classroom work, but they have breakfast with them.
And what's the benefit of that?
Well, more children will be able to eat breakfast than previously, and we find that all the studies say that children who eat breakfast do better in school.
Give us an example of the meals that the students are eating for breakfast and for lunch in Louisiana Public Schools this year compared to maybe 10 years ago.
The school meals have drastically changed. They must be very low in fat and saturated fat. There is a calorie range that is appropriate for 3 different level age grade groups. The focus is on fruits, vegetables being half of the lunch meal and half of the breakfast meal. And the whole grains have increased. It's to 50% this year, and it will be 100% next school year.
I was asked to come down and talk about the Tennessee Coordinated School Health Program and how we run our program compared to other states and how it's different. And Tennessee's unusual in that we have a coordinated school health law that dictates that every county in Tennessee, every LEA, has to have a coordinated school health program. So we're just here giving some ideas on how to expand that in other states as well.
Tell us a little bit about what you're doing in Tennessee. What does an individual school in Tennessee do when it comes to promoting child wellness?
Each district in Tennessee has a coordinated school health coordinator, and they're responsible for carrying out all 8 components of the coordinated school health model that was designed by the CDC. And that is their primary responsibility, to make sure that all 8 components of the coordinated school health model are implemented in their county and make sure that the kids are getting the information they need to be healthier students.
What are those 8 components?
The 8 consist of, there's health education, physical education, health services, which is more your nursing, nutrition services in the schools, school environment, how healthy is the school environment, especially for those kids who have asthma. It's real important to know how the air quality and things are in the school. Staff wellness is huge because we know that healthier teachers, if healthier students learn better, then we know that healthier teachers teach better. Family and community involvement, those are pretty much all the components that are in the model.
What kind of progress has Tennessee made in implementing these in its public schools?
We've made huge progress. The nice thing about Tennessee is that we are state funded. Our coordinated school health program is state funded, and we have a state law. It's funded at $15 million a year, and that money goes to provide a coordinator in every county that carries out all 8 components of that model within their county. We've seen huge results. We have dropped, our primary focus is body mass index, the obesity in our children. And we've dropped 2% in our body mass index across the state. When we collect data on K, 2, 4, 6, 8, and 1 grade of high school of all the students in the state. And we've seen a 2% decrease in our BMI rates.
What's your recommendation for public schools in Louisiana to promote health and welfare among their students?
I think the most important thing is creating partnerships. Partnerships are huge. That's where a lot of the funding comes from. If you can create those strong partnerships, then they can help get the message across and help fund some of your activities.
I'd like to see us get more coordinated so that we are all giving the same message, utilizing the same resources, just coordinating more what everybody knows and linking it all together.
It looks like Louisiana is on track to be doing a lot of good things. They're much further ahead than some states that we've had contact with that have asked us for information and how we're doing things. Louisiana's already collecting a lot of data, and they seem like they're headed in the right direction.
I really am very encouraged. The people here, of course, are very interested in health and wellness. I would really like to see us coordinate our efforts together so that we can have a greater impact across the state and nation.